Should you be concerned if your echocardiogram report shows that you have a pericardial effusion around your heart? It basically depends on what the size of the pericardial effusion is. It's normal for everyone to have a small amount of fluid in the outer layers around the heart. And so, if your echocardiogram report shows that your pericardial effusion is trivial size to small size, that's still usually considered a variation of normal. And you usually don't need to do anything else, and you generally wouldn't get any symptoms from that, most people. Now, sometimes there's other things going around on with the pericardium of your heart, which is the outer layer. And so, if you do have symptoms, you should still see a cardiologist. But if you don't have any symptoms, and a lot of times that's just a variation of normal. If your echocardiogram report shows that you have a moderate sized diffusion or a large sized diffusion, then you generally would see a cardiologist because you may need additional testing. You might even have symptoms. Some people need the fluid removed. And so, some of the things that can cause a moderate to large size infusion, there's a long list of things, but it could be an infection, an autoimmune condition, different medications, cancer, if you've had some sort of trauma to your chest, if you've had a heart attack recently. So there's a lot of different things that could potentially cause a moderate to large size diffusion. And so you would usually see a cardiologist, especially if you're having symptoms, but even if you're not having symptoms, to see if you need any further testing and if you need the fluid removed, to send the fluid for testing. Or sometimes people get symptoms if it's a large size diffusion of shortness of breath and chest pain, dizziness. If you ever have any symptoms, you should see a cardiologist for sure. And so if you have any cardiac symptoms, you should definitely see a cardiologist. But sometimes that can be coming from the fluid, or the fluid can be causing a compression of the heart chambers if there's a lot of fluid. And so definitely see a cardiologist if you are having symptoms, or if it's a moderate to large sized effusion, then you would still also need to see a cardiologist.